So thank you for coming. Let me once again introduce myself. I'm Jana, and in the following 10 minutes I'm going to share with you my findings or our findings about wellness programming for older adults. I personally and currently am a PhD student at the Faculty of Sports Studies at the Masaryk University in Brno, in Czech Republic. And I thank you and the other organizers for the possibility to be here and give you this presentation. My presentation will be about wellness programming for older adults, and maybe we can start with the question, why older adults? One of the possible reasons is that my surname, Stara, means old in Czech, but no, that was not the reason.
In Swedish language, Stara is old.
It's the same?
My language.
Yeah, that was not the real reason why I focused on older adults. The real reason is that the age group of older adults is one of the groups I will work with in my research. In my PhD research, I design an intervention program, a wellness program focused on quality and healthy life. And older adults are one of the expected participants. And for more, I was giving a month ago a lecture on University of Third Age, which is a special program at our university for retirees. And I presented my topic there, and I just wanted to know if I'm completely off the topic for them or if it's interesting, and if they would be interested in participating in my project. And maybe the next question that pops up in your minds is, why wellness? Why am I not talking about health or physical activity or lifestyle? I suppose, please hands up those of you who have already heard the word wellness. Are you familiar with it? And those of you who have imagined something like this, if I speak about wellness programming for older adults. Yeah, wellness in our European notion is this center we have here, even in the hotel, the spa and massage. But if you would dig deeper behind or for the meaning of the word wellness, you would find more theory and realize that there are no massages or spas needed. The theory behind wellness is a bit complicated. I'm not going to dig deeper into this. So I will show you this illness-wellness continuum from Dr. Travis, which is one of the founding fathers of the wellness movement in the United States, where wellness is very often tied in context to the medical treatments. So as well on his continuum, the difference between wellness and medical treatment is that the doctor with his pills and procedures can help his patients with those disabilities, symptoms or signs, but he can only bring his patients to the neutral point in the middle of the graph, where there is this physical health, where there is no pain, but that doesn't necessarily mean that there is everything in life. So that wellness paradigm, as he names it, goes beyond this neutral point and wants to help people to go beyond the physical health, to reach the life you want to live, the point where you actually want to get up from bed in the morning, where you can enjoy the full potential that you have at the very moment. And I think that in our case, from sports science, majority of our trainers or practitioners, nutritional therapists, are usually on the treatment paradigm when they tell their clients what to do, how to exercise, what to eat, but they can't really help them go further. And I think, and I propose in my research, that the wellness perspective can broaden our practice more further and further. But if we look at the programming, general programming for older adults, there are numbers of papers that go for the characteristics of health seniors. That in this, I just choose one from Mr. Clark, who described those seniors as active. Those people who regularly keep in touch with their families or friends, are confident, live in healthy environment or safety environment. They sleep and rest well and manage stress well. These are the characteristics we want to enhance in people. But still the majority of programs focuses on physical activity, exercise, it's good for you, eat healthy, it's good for you, and have this positive outlook, smile, because it is good for you. We know it works. We are the scientists, we have the data, we have the papers, we have read all the books. And the papers I found prove that especially the age group, the seniors are one of the groups that are very eager into participating in those programs. They are able to learn, but the results are unclear. At some cases I found they stated that the participants were really happy about participating in the program, but it was not, the biomedical measurements they did with them afterwards didn't prove any big differences. So why I talk about wellness programming, and I propose, and authors Armbruster and Gladwin go with the same idea, is the shift from segmented approach when we tell people how to move, what to eat, how to smile, and the shift to more holistic approach. They would go with the holistic definition of health as the complete state of physical, social, mental, and spiritual well-being. And because if we want to underline the reasons why people don't follow our orders, we give them the road to follow, and they just don't do it. What I try to do with my research is to maybe design a way how to make it easier for people to follow our orders, but in a way that they want to follow it. Only this way we can address the behavioral and lifestyle changes, because they go much deeper underneath the knowledge itself. And bearing all this in mind, I did the literature review that you can find in the conference proceedings. So I will not go into all the details that are in the full text, but I will only give you a short notice of the major ideas I found there. The biggest component still, even for older adults, is the education. People want to learn, they can learn. It's good for their cognitive abilities, and it's good for their self-esteem and self-efficacy. Being aware that you are on top of things, that you can manage still your life, which is one of the very important things seniors need to have or feel. And in this education, it's important to cover all the topics that are relevant to one's life, to cover all the holistic perspective of health or life, not only the physical activity, which we like the most, not only the nutrition that is important as well, but also things like communication or finding meaning. These things, when they are not addressed properly, they make our work harder. The next point that many authors kept proving together is that there is a big need for community, the support that one needs when he starts new life, say. When I think we would all agree with this, that when we are trying to start a new habit, it's always easier to have somebody there with us, to have the people around us that we can see they have the same problems, the same ideas in head, and they give you the support to change something. But the community goes not only through the same age group, but also to the community of families, when nowadays many families are broken due to younger people studying abroad and families moving and living apart. So the wellness programs turned out to be the good occasion for people to come closer together, because maybe sometimes at home we are not very used to sitting behind the same table and just talking about things. Many people just don't do this, and the wellness program can be something that enhances this. Organize a mother and father party, and they will come, and they basically can learn a lot about each other, even if they've known each other for a long time. And of course, the community goes even to the local community at all. Even elderly people have still value to share with others, not only on the level of taking care of kids, but they know things that I so far don't know. Everybody knows something, and they have their value even if they no longer are in productive age. So it's value to work with. Next thing that is important is the empowerment. Empowerment and engagement are the keys to make people interested in changing something like lifestyle habits. It's so easy to do the things the way we did it many years ago, and empowering people gives them the reason to start new. For us to empower them means to choose methods, different methods than just giving lectures, because lectures are full of the education I listed at the beginning, are full of facts, but people have to think about those facts. So the practice of experiential learning, reflective learning, messages that are not fairly theoretical but are tied to one's life are more easily applicable into the changes we want them to make in their lives. So it will also want us to change the way we teach or we work. And by long-term intervention, I don't mean that our lectures should be long. It would be boring. It would go against what I mentioned a few moments ago. But long-term intervention in the papers I've read is that to really be able to change something like lifestyle, it has to be a longer period of time. My research is 3 weeks long, and the papers I found were from 6 weeks to 4 months long. It's continual work because you just don't change your life by saying, I'm going to be healthy starting tomorrow. It always will be tomorrow, never today. And we have to be there with the people who want to change. It's still the major idea is that they should want to change, and then we can help them. And if you look at those 4 major topics that kept rising from the papers I've read, they are not specific for the age group of seniors. Only like the content that would be in the middle of education would be changing with the age group. The topic that people are interested with declining health or so changes. But having the community support, it's still the same for adults or younger adults. Being empowered, still the same, and long-term intervention, that's just the way it is. So I have gone off my time, so I thank you for your attention. And if you have any questions, we can leave it for the time after the last presenter.
Dziękuję, Jana Stara.